The pandemic led to a surge in mental health problems for young people. The timing is horrible. Treatment and recovery for kids with the most serious issues is being hampered by a crisis in the psychiatric residential facilities in this state.
The crisis has many causes and can be found in both public and private facilities, but it's a crisis few people know about. As our TV 11 News investigation found out, the problems are mostly out of sight because there's very little oversight. Here's Rolly Hoyt.
The nickname that some of us had for it was the misery mill. There was no hope of ever actually any kind of psychological treatment. It was psychological mistreatment, and they knew it.
We would like to think treatment for mentally ill people has evolved from the dark ages of insane asylums, especially when it comes to treating children. But here in 2023, according to the dedicated advocates charged with keeping tabs on psychiatric residential treatment facilities, there is a serious crisis.
The large part of these kids' lives in these facilities, they are literally sitting around. That just is obviously not going to ever end well.
Reagan Stanford is an attorney with Disability Rights Arkansas. That's the watchdog group mandated by the federal government to monitor anything that affects the lives of Arkansans with disabilities. That includes mental health disabilities, and the place is geared toward helping kids. Stanford and her boss, Tom Massaw, say they've been trying to raise alarms about a crisis in the 13 PRTFs licensed by the state.
They are supposed to be a safe environment for kids with the goal of getting the treatment they need to move out. And what we're seeing is that is not happening.
You essentially have a constant state of chaos.
Stefan Specht says he lived it. A troubled teenager from a badly broken family, he landed in private residential facilities when county social workers couldn't find a place for him in a state-run home. He says his worst placement came at Mill Creek in Fordyce.
Essentially, most of the day you are locked inside of a small living area. They have a TV, but it was often broken because it would get broken during altercations.
Stanford supports Specht's descriptions based on inspections she's made at Mill Creek and similar facilities. Out of frustration, DRA started a publicly accessible database of inspections, incident reports, and police logs. In 10 months last year, the 162-bed facility logged nearly 60 issues that needed investigating, including staff members charged with assault or theft. That's about average for all 13 locations. The issues also included kids escaping, or elopement as it's called, occurring almost every month from Mill Creek. Patterns emerge as you read all the incident reports that DRA now posts online. Clients, as they're called, often face violent threats from peers.
You could be beaten half to death by a guy who just for looking at him at the wrong time.
Reagan and Massaw point to a pair of distinct problems: understaffing, especially of support workers, and a lack of actual therapy taking place from the overworked professionals who are there. No one from Mill Creek would speak with us on camera, but they did send responses to a couple of our questions. They say the labor environment has posed challenges, but say they follow strict staffing protocols to ensure safety. As for care, the statement says they consider their staff healers. All patients have a prescribed treatment plan developed by a licensed psychiatrist with one-on-one therapy at least once a week. They consider group therapy, recreation, family therapy, and importantly, school as part of their, quote, ongoing milieu that occurs daily.
At most of the facilities, they're getting 1 hour of individual therapy a week. There's one facility that is giving them 1 hour of individual therapy a month. At a psychiatric inpatient residential facility.
Fixing a problem as complicated as this requires knowing where to turn to get help, but identifying that avenue is as complicated as the problem itself. There's an alphabet soup of government agencies that oversee different facets of this, and an executive review board. Many of them are centered right under this roof.
The way the law is written, we have to, take it to the board. We can make a recommendation, and we do make recommendations. We've made several in the past 3 years.
Tanya Williams is the Director of Child Care and Early Childhood Education for DHS. Some of those alphabet agencies answer to her.
It's in the collaboration of all the entities involved. The way it's going to have to work is getting all the people together to talk about how do we do this better, and then making sure that any concerns are reported to the appropriate parts of agencies that can do something about that.
Getting all the people together to talk is supposed to happen once a month when the Child Welfare Agency Review Board holds public meetings. DRA planned to present new evidence last month, but the December meeting was canceled amid scheduling conflicts. Meeting minutes from the past year indicate the board spends much of its time deciding appeals from people disqualified from jobs or being foster parents because of past criminal records or drug or alcohol problems. That speaks to the desperation in staffing.
Or you're hearing things that makes it even less likely that you're going to get even qualified people, but even unqualified people who want to come to work for probably less than ideal pay.
Some facilities have staffing issues worse than others. Perimeter of Forest City has had a mandated corrective action extended twice due to staffing and security issues. The facility has since agreed to stop taking in new clients. Even the sprawling United Methodist Children's Home of Little Rock needed to take action. Staff were on the job before background checks were done. Notably, the CEO of Methodist Family Services, Andy Altum, is also the chairman of the review board. He does abstain from voting on items involving his facilities, but he's one of a few board members trying to oversee everyone and run a facility at the same time.
You're building the plane while you're flying it. So I think it's much more complicated than, oh, let's take a few parts out. I think there are probably a few things that we could tweak.
A tweak each of these advocates all agree on, improving the skill level of who gets hired.
Well, we have the lowest licensing standards across the country.
So they do the Arkansas minimum licensing standards, which are minimum.
Our licensing requirements are very minimal. You know, the age is young.
By changing who gets hired in these facilities, DRA hopes could lead to changes in the boardroom.
I think it's important that the board members of these facilities really go beyond the administration building. Instead of having these glamorous fundraisers to raise money.
And SPECT just hopes to get the word out.
Sound off alarm bells to the average citizen that if they have a child that is experiencing mental illness, that they should think twice about sending them to one of these well-marketed facilities.
Each person we spoke with is trying to focus on the kids, recognizing what they've already gone through and building from there.
At the end of the day, it has to be about the kids, and it has to be making sure that the kids are safe.
I sit here and cry some days because nobody could believe that 12 and 14-year-old children are having these experiences. I don't think it's a parent thing. I think it's a societal thing. Like, we should all be ashamed.
For 11 News Investigates, I'm Rolly Hoyt.